welcome back. Dr. Ben Emery from Aspen Ridge Dental joins me now. Doctor, thank you for coming in today.
Thanks for having me this morning.
So we're going to be talking about a lot of people's least favorite thing, especially about going to the dentist, and that is having a cavity. Because nobody likes it, nobody wants to deal with it, but if you don't take care of your mouth, they happen.
That's
so
right.
Why do they happen?
Well, food products that get stuck in between people's teeth are the main culprit. Now, the normal bacteria that are found in people's mouths, they metabolize that food product, secrete acids and byproducts, which are sticky, and those acids then get etched into the teeth, and then the etching turns into a cavity or tooth decay. And it starts really small and then gets bigger and bigger and bigger over time. And with some people, it gets big pretty quickly. Other people, it takes a while for the cavities to develop and get to the size where your dentist would diagnose it and say, you know what, it's time to have that filling done, or whatever the procedure is to fix that.
Is that especially true if you consume a lot of sugary foods and beverages, soda, candy?
People who do that are more prone to getting cavities more frequently. The degree of cavity penetration is a lot higher also. So yeah, people who consume a lot of sticky foods or a lot of starchy foods are a lot more susceptible to getting decay.
Okay, so tell us about the cavities here. What do you see on an X-ray?
So I wanted to provide education for our viewers about what a dentist looks at to diagnose a cavity, and so that our viewers are prepared when they look at an X-ray and the dentist shows them what they're looking for, that they can understand and relate to what it looks like. Mm-hmm. So this is the left side of somebody's mouth. And a cavity shows up in between the teeth here. These are interproximal cavities or flossing cavities where a toothbrush can't reach, and so that's why flossing comes into play, so that the floss will go in between the teeth and remove the food products that's stuck there. Mm-hmm. So a cavity shows up, this is a small one, it shows up that dark line that goes across the tooth. Now, a small cavity is a lot smaller. It doesn't penetrate that white line there. This is the demarcation between enamel and dentin. The enamel is the hard outer shell. The dentin is the softer inner part of the tooth. And once that decay gets in past the enamel, the decay gets bigger a lot quicker. And so at this stage, the dentist will diagnose it as being a cavity and would recommend doing a filling at that stage so that it doesn't get any bigger, so you don't have to look at doing a root canal or, something more extreme like an extraction.
Definitely. How is this one different?
So this picture shows the next progression. Let's say this person is really highly susceptible to tooth decay, and let's say this is 6 months or a year later. This cavity here is a lot bigger. You can see that the entire white striation here is completely broken, and the dark area is all the way inside the tooth. So you're looking at more of a costly, more time-consuming procedure, possibly a root canal to fix something like this. And now this tooth right here shows a very, very large cavity where it did start small like in our first slide, but over time it gets bigger and bigger and bigger. And now really the only option for this patient is to have that tooth taken out, because you can't restore a tooth with a cavity that large. There's not enough tooth structure. So
definitely.
That is,
you got to make sure you're going to your dentist twice a year, right?
That's right.
All right. Well, thank you for coming in and sharing the information.
Thank you.